Hi everyone, I'm Kelly,
And I'm Kate.
and we did autism spectrum disorders.
The prevalence of autism spectrum disorder is increasing globally based on studies conducted in the past 50 years. About 1 in 160 children worldwide have autism spectrum disorder, and this is approaching about 1% of the population in US and non-US countries. Compared to that, 1 in 68 children in America have been diagnosed with ASD, and there is a variation based on gender. It is about 4.5 times more common in boys than girls to be diagnosed with ASD. Just to compare that to another country, about 1 in 115 children in Mexico have been diagnosed with ASD, and this is 400,000 children and adolescents that are in need of services and are affected by ASD in Mexico. To talk about a few other racial and ethnic backgrounds in the U.S., 1 in 100 Hispanic children in the U.S. have been diagnosed with ASD, but autism spectrum disorder is present in all racial, ethnic, and socioeconomic groups. The criteria for autism spectrum disorder based on the DSM-5 has two main criterion, which is deficits in social communication and social interaction, and then restricted repetitive patterns of behavior. As we talked about last week in class, the DSM-4 used to have separate disorders, with autism being its own, as well as Asperger's, pervasive developmental disorder, childhood disintegrated disorder, and Rett's disorder, and now these are all merged in the DSM-5 as autism spectrum disorder. So children who are diagnosed with ASD will be on a spectrum from level 1 being mild to level 3 being severe. And the criterion to diagnose the children on the spectrum is the deficits in social communication and social interaction, which could include social reciprocity, which is how a child responds and reciprocates in conversation. Joint attention, if a child doesn't want to share interest in something that they enjoy or like, such as a toy. Nonverbal communication and verbal communication. For nonverbal, a child could not be able to interpret certain social cues or gestures, such as someone frowning or crossing their arms. The child may not understand that that person is sad or upset. And social relationships, a child with ASD may have trouble developing and maintaining relationships and friendships. And the second important criterion is restricted repetitive patterns of behavior, interests, or activities. And children diagnosed with ASD may be very fixated on certain routines and very defiant against change. They may want to take the same route to school every single day. They may know extensive knowledge on a certain topic and be very obsessed and overwhelmed by this topic and know a lot of information about it. And they also may perform repetitive movements such as hand flapping, rocking, or spinning. These criterion also have to be present from early childhood. Most children with ASD are diagnosed by age 2, and they have to limit or impair everyday function. And as I mentioned earlier, and I'm going to talk about in a minute, is the spectrum from level 1 being mild to level 3 being severe. And the severity, again, is based on social communication impairments and the restrictive repetitive patterns of behavior, and this affects the central nervous system. This is a figure of the severity level for ASD as shown in the DSM-5. So it goes from level 1, as I mentioned, to level 3. So level 1 is a mild form of ASD, and the child will require some support. This is most known as children with Asperger's, have a mild form of ASD, so they can be very intelligent, very high functioning, but they may have a hard time socially. They will have some deficits in communication, but they mostly will be able to speak in clear sentences, and people will be able to understand them. But they also might have some frustration when their patterns of behavior and their repetitive patterns are disrupted. Level 2 is just one step up from that. The child will require substantial support. They will have more deficits in verbal and nonverbal social communication, and they will be more fixated on certain behaviors and patterns of behaviors. And then level 3 is a very severe form of ASD. The child will require very substantial support, and this is severe deficits in verbal nonverbal communication. So a child will have very little intelligible speech. You may not be able to understand them. They'll have trouble making eye contact, will use words that seem odd or out of place. They may have facial expressions or gestures that don't match what they're saying. They could talk in an unusual tone of voice, so in a sing-song voice or a flat robotic-like voice. They'll have a lot of difficulty with back and forth conversation, and they may respond in unusual ways to affection or anger. There are a number of comorbidities that may occur with autism spectrum disorder. These are just a few, usually the most common, but there are a lot more than this. ADHD, attention deficit hyperactivity disorder, anxiety disorder or depression, developmental coordination disorder, intellectual impairment, avoidant and restrictive food intake disorder, and structural language disorder. And a study found that 30% of children with ASD also had intellectual disability, and this could cause a condition characteristic of ASD, which is epilepsy. A few other condition characteristics are sleep problems like insomnia, digestive problems like constipation, and language deficits. And once again, this affects the central nervous system, mental functions, sensory functions, and voice and speech functions. There are many forms of intervention for a child diagnosed with ASD. Early intervention is the most important thing to give the child the best treatment and high quality life and independence that they can possibly have. A form of intervention is pharmacology. So there is no specific medication to cure autism spectrum disorder, and there's no medication to treat it specifically. But because there are so many condition characteristics and symptoms of someone with ASD, there are a number of medications they can take to help with these symptoms, such as hyperactivity, aggressive behaviors, insomnia, anxiety, or depression. So a person with ASD may take an antipsychotic medication to help effectively regulate their aggressive behaviors. They may also take a number of psychopharmacological agents, and these can help treat their behavioral and emotional concerns, which could be anxiety, depression, or insomnia. Another form of intervention someone diagnosed with ASD may seek is medical intervention. These forms of intervention are shown to be very highly effective. And as I mentioned before, since there are so many symptoms and the spectrum is so vast, there are a number of interventions someone may seek. So one that is very popular and proven to be highly effective is ABA, or Applied Behavioral Analysis. This is when a specialist will use a system of reward and consequence. So they use positive reinforcement to promote positive behaviors and have these positive behaviors be repeated. So this will obviously improve behavioral problems, but it can also improve a person with ASD's communication and social skills as well. Sensory integration is another one that is used very commonly and is also shown to be highly effective. Because a person with ASD may be very sensitive to sensory information such as sights, sounds, smells, things like that, it can really make their everyday life very difficult, and they will have a lot of difficulty processing sensory information. So a child may be very sensitive to sounds, and it may be difficult for them to concentrate in class or to even fall asleep. So these specialists will use play activities to change how the brain reacts to the sensory information. Another one is CBT, or cognitive behavioral therapy. This is used it's a form of behavioral therapy, but also thinks about the child's thoughts and feelings that can cause these behaviors to occur. So it regulates their emotional impulses and can reduce anxiety or depression. And this form of intervention is very valuable because it can be individualized for this specific person with ASD and really focus on their needs. Another one is parent-focused intervention. This is just where parents would go to a class to learn skills and activities that they can implement into their child's everyday life and really help them at home, not just when they're going to a specialist or therapy. They can be doing these activities all day long to really help them more. Developmental skills approaches focuses on the interests and the activities a person with ASD really enjoys, also while providing a consistent and structural environment. Speech therapy is very important for a person diagnosed with ASD because a lot of them have severe communication and social problems. So this can help obviously with their communication, but also with their tone of voice. How I said the sing-song voice or the flat monotone voice before, this can help them with that. Also help them understand nonverbal cues and help them understand things like humor, eye contact, and gestures. And then relationship-based approach really focuses on emotional and relationship development. As I mentioned before, someone diagnosed with ASD may have problems developing and maintaining relationships or friendships, so this can help them with that. There are also a number of alternative interventions that a parent of a child diagnosed with ASD may seek. These can include special diets, so eliminating gluten or casein from a diet, as well as avoiding sugar or artificial dyes, have been thought to reduce symptoms of ASD. However, there is no research to support the validity of these theories and approaches. And there also are holistic approaches that someone may seek, such as massage or yoga. These have been seen to improve social and language skills as well as promote positive and appropriate behavior. But again, there is no extensive research on these to support them. It should be said that alternative interventions are very controversial. However, a lot of parents will seek this for their children diagnosed with ASD. About 1/3 of parents with a child with ASD will try an alternative intervention, but 10% of these can be using potentially dangerous treatments, so it's very important for parents to be aware of this and to keep their child safe.
There are a lot of interprofessional team members to attack the onset of autism. So a pediatrician, they're usually the first ones to notice the first signs of autism in routine checkups annually. So usually around age 2 is when the symptoms are first known, which are usually no affect, a lack of affection with family members, not wanting to be held and not making eye contact. So the pediatrician will recommend you to developmental pediatrician, and they will guide you through the rest of the process with the diagnosis of autism. An occupational therapist, those are important because they help you gain independence in everyday tasks. So like your ADLs, which are dressing, showering, toileting, and play, for example, along with IADLs if they're a little older. Individuals with autism typically experience moderate to severe difficulty with ADLs, IADLs, education, work, leisure, and play. So the OT will work with the child along with the family to integrate that child into social interactions and help break those unbending routines and repetitive behaviors that they have, which are the core issues of autism. Usually the OT will use a lot of sensory integration and behavioral therapies because those seem to be the best treatments for autism. And it's appropriate for an OT to set attainable goals for every individual and understand that they are limited, but they do have capabilities to achieve the goals. The speech language pathologists, they increase the individual's quality of speech. It's a fact that half of individuals with autism never develop speech, and most fail to use speech in a functional way. So a speech language pathologist will help, let's say a younger child develops like words to communicate with their parents or teachers, and if they really are having a hard time with that, gestures such as like no, stop, and physical features, facial features, they'll help the child learn those for communication. Using labels in a household or kitchen, for example, will help a child develop more language because they can see the words and they'll know that they have to use them in everyday function. And the speech language pathologist will also address the core issues of autism. A physical therapist is needed with the onset of autism because they address the limitations in movement, muscle tone, coordination, and balance. So a child with autism usually is stationary. They don't want to engage in play or go for walks or be active like other kids without autism do. So it's important for a PT to make assessments on their everyday tasks and how they move throughout their day and their household and everything to see where they're at and help make adjustments towards their life, towards a healthier life. The goal mainly for a PT is to improve functional mobility through new ways of exercising. In the picture, you can see a PT with a child who's hanging from a bar, so they're engaging their arms, their backs, and they're swinging. That motion is using their whole body to move from one place to another, and they see it as also a sensory way of engaging in exercise and play, so that seemed to have helped a lot of children with autism. And a gastroenterologist and dietitian. They're important also because children with autism usually have gastric problems, so they recommend the removal of gluten and casein from their diets. Kate mentioned before that there's not much scientific evidence about this, but it's a new way of attacking autism. Usually the gastric problems consist of IBS, bloating, constipation, diarrhea. So because they have a poor sphincter control. So a gastroenterologist is really important in a child with autism. Social workers are really important with a family that has a child with autism because they work well with the family members to help them understand and support their child with autism. Autism is a tremendous burden on a family, and it can be devastating for someone to watch their child not flourish the way they intended their child to. So it's important that the social worker works with the family really well, because if the family's on board with how autism works along with the social worker, then they will work together for better outcomes for the child. So that's really important for the child to know that their parents support them even though they don't really understand what's going on. So the social worker is a main aspect in this diagnosis. Settings for autistic children should be restricted, safe, and functional. So sharp objects, dangerous obstacles need to be known and moved out of the way of the child. So gates, covering outlets, and childproof locks are usually what families use for their children to keep them safe. So children with autism are strict with routines and patterns. So families who want to, for example, go out to dinner have an obstacle that they have to tackle because their child is going to be very frustrating and confused on why their pattern is changing. So parents need to work really hard to keep these patterns as routine as possible to prevent any issues. And in public schools, some parents decide to mainstream their child if they have less severe autism, and this is a good and a bad thing because their child will engage in social interactions and be involved with other children, but on the same time, they will be noticed as different, which is the negative part because children could make fun of them and like pick on them and bully them, and that's going to lead to other problems with that autistic child, so that's unfair. Teachers and special education teachers need to really work with the child that has autism because they will be seen as different in the classroom by other children, and they need to understand that they are equal and they are there to learn and they are there to socially interact with other children, but they will need to be in different classes to have different one-on-one education with, let's say, an OT or just a teacher to work on their behavior patterns and learning. If there's a more severe case of autism, it can be helpful if their child is in an inpatient care facility. Some parents really do not want to do this because they feel like they're abandoning their child, but some parents just can't treat their child functionally in the home because it could be too dangerous for other siblings, or just they need more help than they thought they did. The inpatient care facilities usually specialize treatment for that individual and work with them one-on-one, as well as integrating them into groups. Sensory integration is really important in these facilities. That could be finger painting or touching Play-Doh, anything to engage the senses and help the child learn in more ways than one. But it's important to not overstimulate the child because then the learning will just be eliminated because they could have a breakdown and they could just avoid every source of help and they won't want to learn anything else. Another aspect is individualized education programs. These programs go along with ABA programs because they analyze the strengths and weaknesses of the child and set appropriate goals for the child to attain while in these programs. Um, Again, it's important to understand that parents need to work with these education providers and healthcare providers to understand that the child is not limited but has capabilities to learn more things than they thought. So there are many occupations affected by autism. The activities of daily living are the main occupations that are affected. So, for example, dressing and getting ready for the day, hygiene aspects, which are brushing your teeth, combing your hair, taking a shower or a bath, toileting, as mentioned before. Usually, autistic children have poor sphincter control, so toileting can be a process, but it's important to work with your interprofessional team members to address that issue and have the child work in a functional way. Eating, so this cutting your food, putting the fork to your mouth, knowing that some bites are too big, some bites are too small, and learning how to possibly prepare meals depending on the child and the level of severity. Instruments of daily living, if a child is age 16 and older, driving and community mobility, that could be an issue because if the child is not stable enough to drive from here to there or walk around in the community on their own, then that's another issue that is going to have a problem for them as well as their parents. Financial management, if, for example, a child or a young adult with autism is living on their own, they have bills, they have to go shopping and buy food and clothing, for example, so they have to understand how to balance their money and not spend too much here and not enough there and see what they do need in life rather than what they don't need. Younger children, play and exploration and participation in group play have an impact because they do not want to engage in pretend play. Your examples are like playing house with children, or just playing in the backyard with friends. They won't want to engage in that. And changes in role play that, for example, like playing house, there's a mother and there's a daughter and there's a dog and a father. They won't want to see the repetitive, like the repetitive routines will not want to change involving that play because they are used to a specific way of life and those changes will make them shut down and get frustrated. Rules with games, some children, every child likes to win games, but if there's a rule that prohibits them from winning or getting ahead, then autistic children they really have a tough time with engaging in these rules. Using new toys is an issue because some children have a strict enjoyment playing with one specific toy, and that's why the OTs and the interprofessional team needs to introduce new things to involve their other senses and get them adapting to new ways of play rather than just sticking to what they would like to do. More occupations affected by autism are play, exploration, and participation. So a child with autism would prefer to be alone and they aren't interested in working or playing with other children. Like in preschool, they'd rather just play with blocks on their own or just sit in the corner and not get involved with other children. They want to do what they want to do only, so they don't have an interest in moving from blocks to playing with dolls or with trucks or anything. So the interprofessional team needs to work together to introduce new ways of play via toys or play with other children. Work opportunities are very limited for children with autism because some employers, just as horrible as it is, don't want to hire people with autism, whether or not they can function really well or they have the ability to work in certain places. We have a video to show you at the end of this that will show an example for autistic people working in a grocery store. Other reasons why they have little opportunities for work is because, like we mentioned before, they don't really like a change in their routine or having rules to follow because they like their routine and what they want to do. Education can be very difficult for a child with autism because sitting in a classroom setting can be a lot for them, and being around other children socially can alert a lot of their stimuli so they can't focus, and the peers can be distracting. Like we mentioned before, they could be bullying the child, and they could be bullying the child and really just hurting the child mentally, which is not what anybody wants for education. You're there to learn. Non-academic aspects of education are like recess lunch and just walking from class to class in the hallway. This could be overwhelming for a child with autism because there's a lot of stimuli everywhere. There's a lot of children, there's teachers, there's a lot of noises, it's crowding, and that could cause a lot of havoc on that child. And extracurricular activities, so joining clubs, being on a sports team, that is another occupation affected by autism because children they won't want to engage on a team or join a club or change a routine that they like to do. So the interprofessional team will work with that child and try to integrate them if they are at a stable level to be with other children and participate in other activities rather than just being on their own.